me recibió, ni me preguntaron, pero la pusieron, porque era un derecho y una obligación. Y aprendí colores sin mapas y letras, la vida al cuadrado, coseno, matriz.
I invited Dr. Luther Castillo to come to New York on short notice. I just met Dr. Castillo a week and a half ago in Chicago, because he is someone who has taken the responsibility to do what we can do and do everything that he can do to change those statistics and change the situation that's causing those statistics. Both in Honduras, because it's the same kind of disparity there and much worse poverty than here, of course, and in Haiti. And he has worked in both places and is, of course, from Honduras. And we need to do the same here in the United States. Honduras is one of the poorest countries in Central America. And the majority of that country's wealth rests in the hands of foreign companies. That means it ends up in U.S. banks. And in 2009, an elected president, President Manuel Zelaya, was overthrown by a military coup. And that happened after he had embarked on putting out a national referendum for the people to discuss their desire, give their input towards their desire towards reforming the Constitution that would be one to the more benefit of the people. And just having put that question out and started mobilizing towards that possible referendum, right after that there was a military coup. And that same coup targeted the first Garifuna Hospital, which Dr. Castillo had founded there, where many had never seen a doctor before in their life. The leading example that Cuba is giving the world in training doctors from throughout the developing nations and assisting in showing how to wipe out diseases of poverty and sustaining the human right. And so with that, we'll introduce Cecil Castro, who is head of the New York support committee of the first popular Garifuna Hospital.
Thank you.
Thank you.
Thank you so much, Susan. It's a great introduction. And also thank each and every one of you, audience, for being here today, so that you can learn a little bit more about the whole struggle, the whole effort of Honduras, not only the hospital, but of Honduras. The whole political turmoil, the difficulties that the communities have faced before and during and after the coup of 2000. And on top of that, Dr. Castillo, since he graduated medical school in 2005, has never, ever charged a single penny for his medical service. So, without further ado, Dr. Castillo.
Good night, brothers and sisters. It's a great honor for me to be here. I came from a matriarchal society where men give the last word. Yes, my love. And I was happy to come here to have some hours and share with you. It's a great honor for me to meet wonderful people like you. Then I'll try to speak in English. It's very difficult, hard for me, but I'm learning so hard. And like you say, I'm from Garifuna people in Honduras. We have some Garifuna brothers here from Honduras and from Belize who are joining us. Yeah, it's a great honor. Then we are almost few days to the 2015 years of Garifuna arrival to Honduras. Then we are almost 250 years of Garifuna arrival to Honduras. arrived 1797, 12th of April. My grandfather used to say that it was a Wednesday, 3 o'clock in the afternoon. I don't know. I don't know if it's really. But we arrived to Honduras after being in survival. Then Garifuna people come, origin from Red Carib, who were living in the island of San Vincent, who mixed with Arabics. Arabic were coming from the river of the Orinoco River in Venezuela. From that union between Arabics and Carib become a new society, what we call Amerindian. This Amerindian mixed with men and women who came from Africa. But history say a little bit more than that. There was, our grandparents used to share with us that there were 5 big boats in front of the island of St. Vincent, directed by England and French, who brought men and women from Africa for slavery. And in front of the island of St. Vincent, they killed the slave master and freed the other 5 boats and run away to the island of St. Vincent and build in the mountain of St. Vincent a big community of Cimarrones, the people who was brought to slavery but never become slaves. Then history used to say that they was very welcomed by the Amerindian people in St. Vincent. Then it was a union between those men and women who arrived from Africa, who was welcomed by the Amerindian, and from this mix become Garifuna people. But years later, British was thinking how to re-enslave the new black born in St. Vincent. Then there was a war between Garifuna people, and British Army for more than 10 years. And there was this war, it was for people to defend our right, to defend our nation as a Garifuna people, defend our culture. But history thought something who become like essential part of the struggle. How the Garifuna women was the one who encouraged our chief Joseph Satuye to fight against British. The history say that when she arrived to the farm, they see a lot of cow destroying farm. And she returned home and say that word to Satuye in Garifuna, Satuye, hagaderi alundu na wachai. Ani manigi tikulu bere regonia, rubo mbigala sono, nichiko benigudubu, yidu na mgere regon. I don't know how to say it in English. But you can imagine. She told Satuye, Satuye, British are destroying our farm, and you don't have the courage to fight against them. Then give me your pants. I'll give you my
skirt.
My
skirt.
And I will fight against them. And that's where it was the essential part of that courage that all those people in St. Vincent start to fight for our society. Then they decide to sign the agreement of peace, and that night they killed our chief Joseph Satuye and captured 4,800 Garifuna and ship it to the desert island of Baliso. In the desert island of Baliso, who was a British prison there, they killed more than 2,800 Garifuna, more than half of those people. History didn't talk about that. It was a genocide. They killed half of these people. And the other remnant, another 2,000, they put it in 2 boats and exiled it to Honduras. As you see, we arrived 12th of April 1797. It was not for tourism. We arrived to the island of Roatan, who is now a tourist area, but we didn't arrive there for tourism. We arrived there fighting for life. Then our ancestors decided to go to the mainland in Honduras and build 46 communities along the Atlantic coast. And the first community on the mainland, it was Trujillo, the community where our friend Isidre is coming from. Then they built the other 46 community. Then we still preserve our language, our culture, and we are very proud of being Garifuna. That's why, in the name of our people, I want to welcome you to know something about our history, living in Honduras, and now the Atlantic coast, as you see the map here. Then we have our project in this remote area. We always say in Honduras, where the paved road finishes, that's the beginning of Garifuna communities. Then we reserve our drums, our spirituality. These drums, I think, is for Manolo's drums. Manolo is there. Why I say that Manolo has been participating with us in all the fight that we have been given for this project too. But this is, maybe it's a great picture, but it's a very sad reality. This is what happens every day in our villages. This is a woman in serious complication of birth, who is transported maybe 6 hours in this hammock to get to the river, another 5 hours in this canoe, but another 8 hours in the back of a car to get to the more nearest hospital. This is a record Guinness of bleeding, but it's a reality. This picture, it was something to show us that we couldn't wait anymore to look for some solution. But sometimes when we think too much about solution, it's difficult for us to do it. And I had the wonderful opportunity with many of our brothers and sisters. Tonight, I'm honored to have here Dr. Francisco Perez de Leon and Dr. Naqueta Thomas present there tonight, who was training like me at this wonderful space, Latin American School of Medicine. Who was a project began in 1999, after the hurricane destroyed Central America. We heard a lot about natural disasters, but just for 2 days, our school has been graduating a little bit more than 10,000 doctors from 48 different countries. The largest army of doctors in the world, but willing to go everywhere where really people who really need healthcare need us. Then for us, the resume of the Latin American School of Medicine is a paradise in the earth of the Caribbean, where our dream come true. But in reality, this project changed the face of the medical profession in the world. Now you can be able to see indigenous as a doctors, many black people as a doctors. We talk about that because in Honduras, the National Autonomous University was founded in 1847. And it was after 118 years, the first Garifuna became a doctor. Then we had to wait 118 years. But we had to wait 215 years for the first hospital. But since this project started, in 1999, we have more Garifuna studying medicine in Cuba than all entire, more than 150 years of existence of National Autonomous University of Honduras. That's why this project gives us inspiration and a hope for our people. Then when we arrived to Cuba, we decided to organize ourselves. Knowing about our reality, we cannot be sleeping 8 hours a day. And we were doing a question, what we can do for our people before we become a doctor. We have emergency. Then our companions say, okay, let's donate our vacation to work in the most remote area. It was a great dynamic for us. Return to your area. Some of them were there born with some of the knowledge that you get from the university. You can see more your reality. You can, talk about what we can change. You can be in contact with your future scenario to work, but you become with the dynamic of engagement between you and your community, and between the community and the new professional. Then there was a great dynamic for us. And most of the problem that we face, after we train our human resources from the remote area, they have to leave because of the opportunity, because of the lack of political voluntarily of government to give support to the professional. But on the other hand, when you see the light, nobody wants to return to the poverty. But how we have to build this dynamic for our people to return back, there was a great exercise. Then we were dreaming, because we believe in utopia. Herman Roches is one of our cultural ambassadors of Honduras. He's here with us tonight. He's one of our diplomatic ambassadors, who was one of the fighters with this group with us, creating this idea. And we were thinking three aspects: human resources, infrastructure, and continuity and sustainability. For us, it was the three key aspects for this process. Then we say human resources, then we have the opportunity in the Latin American School of Medicine to train our human resources. But after we return with our money to the community, what we can do to develop infrastructure. But the more hardest work is how to build the continuity and sustainability of this process. As we see, our countries and our villages are full of young people who say every day their dreams die, Then our mind become like a cemetery of dreams. But we were trying to make difference, how we can do it different. Then we were thinking, okay, after we train our doctor in Latin American School of Medicine, how they can go back home and build a strategy. Then we decide and start to plan. When we finish, we have to create a strategy for our doctors to return. Then we design a model how our doctor can return back and do the residency of family medicine inside the community. And they can be able to train midwives, auxiliary nurses, and more voluntary workers in the community. And we can multiply this process of work. This is an image of the first meeting with the community. It was the first meeting. We were traveling community by community, talking to the people what was our dream. And we face many things in this process. Because people in our area, they don't believe in nothing. Politicians come every 4 years telling lies. They tell our people every 4 years, we're going to build a big bridge here in this community. And people say, but we don't have river. And they say, we're going to build the river too. And that's turn our people to don't trust nobody. And sometimes I agree with them. And say, we don't trust people who only talk. Then some people, they say, okay, they donate a piece of land, and we will encourage the people. We decide in the communities meeting that people will be donating voluntary work to build that process. Then we clear the piece of land with the people, and we build the first hospital, what we have here. It's nothing like Memorial's Hospital in New York. But that was our first. That was example to show our people that new hope was coming to the community. Then we worked in this facility for more than a year, talking to these people. We get medicine, donation of medicine, we talk to these people, what was the importance of people involved in the process. Then every house decides to donate 10 days of work. Then we make a calendar, and 7 people per day, 10 people. Then we invite many people when there was the requirement to do it. Then we start to collect materials. Women, the participation of women is essential in the success of this project. No nation can rise any higher than its women. But as you see, this is a process of people. Very exciting for us. That's the first time in history that people from our area have access to the ultrasound. pregnant women that have access to 6 ultrasound during the pregnancy, and they have access to UNIVERSITY to check them every 15 days. They can have access to it, but free of charge. Ultrasound in the more nearest city is 50 or 40 US dollars, but you have to pay another 50 US dollars to read the ultrasound. How can people who are looking for 10 cents to eat can achieve that? But when you go to the line and ask the people, where do you come from? No, I come from La Playa. You know, La Playa, yeah. That's at least 7 hours to get here, 6 hours. Where do you come from? No, up to Sico one time. Yeah. How many hours? Yeah, I left yesterday. How can you tell a patient who left yesterday to come for a free ultrasound? And they walk from far away because they know that when they arrive to the facility, nobody will ask them how much they're gonna pay. Then the people can come from everywhere because the process of access to the free healthcare. There are people maybe who can pay $1, but there are people who cannot be able to pay even a penny. Then this concept of free of charge let us give access to many of our population. And people feel honored to the hospital. Then we have this lab area. Dentist room working in the process of preventive healthcare. Before the coup attack in Honduras, we developed a system to open 11 small clinics in all the university hospital. It was closed for the coup government, and we started the debate. They reached the hospital like 4 o'clock in the morning. They forced the door and entered. They were looking for drugs, they say. You know, even had aspirin there that day, but it was clear action of intimidation. But why? We would like to explain that. Projects like these become dangerous to this system of the healthcare, who have been seeing the death of people and turn it in money. Every day our system, our public system is getting weak because it's the strategy of the government, how they can make it every day more weak to enforce the private sector. Then you have the doctors maybe working in the private sector, and they go to the working in the public sector. We go to the public sector and meet the patient and say, oh, wow, look like you are very sick. You're going to die in 2 weeks. But I would like to, you need an ultrasound, but we don't have an ultrasound machine here. You need a lab, but we don't have nothing here. But I don't know, government didn't give nothing to this hospital. But if you visit my private clinic after 2 o'clock, then I can be able to help you out. But they always ask us, then you are public or private? No, we are not public or we are not private. We are a popular and communitary hospital. But we don't have this concept here. Yeah, you don't have this concept because you have racist rule, basis and exclusion. Because never think before that the people can be able to raise and build their own structure. They never thought before that society was able to give young men and women who were be able to go to school and learn how to read and lead the process of development of the community or fight for the health of the people. Then those clinics was closed during this process because our doctors were showing there another way to do medicine. Giving medical attention in the morning, giving workshop in the afternoon, visiting houses. Each doctor was in charge of 3,000 or 2,000 patients. Then each doctor know all their patients. how to reinforce our human resources. Then we developed a small school of auxiliary nurses in the community. Single mothers who didn't have opportunity to leave the home, but they already have 12th grade, then to train them as auxiliary nurses in the community. That gives us even the strength that we can keep the human resources. We have already graduated 6 of our nurses. Now we are building a program to sponsor, looking for people who can sponsor a nurse to work in the process. Then we dream. This is part of our dream. We're dreaming to make the facility more bigger. This is the area what we have now already built. That we are dreaming to build the surgery room here, pediatric area here, physiotherapy here, and rehabilitation. Natural medicine and Garifuna medicine here. Classroom here, and continue training more human resources. Because we believe that this matter has to be replied. We're facing another problem. Anemia because of the parasites. And parasites because of the quality of water. And you can boil the water in the solar cooker and have a quality of water. We have a specialist here. But I have been reading that most of the parasites die and a little bit 40 degrees. Then solar cooking can boil it at 120 degrees. You know, we can have a quality of water. Then this is an example to do biopsychosocial medicine. Looking for one solution, we find solution to many others. As this is the type of medicine what we believe. We believe in doctors who can go and look for solution with people. Then we have this program for hypertension. We have another program for breast cancer. We are doing a survey in the community for breast cancer. We already type a community like example, visiting every houses, talking to every woman after 15 years, applying an instrument.
Yo soy de la etnia garífuna, de una comunidad de la Mosquite hondureña que se llama San Pedro de Tocamacho. Y bueno, ya ahora después de graduado nos ha tocado en comunidades, por ejemplo en Tocamacho, que hemos ido a atender 3 partos en una noche. Creo que es bastante gratificante, ¿no? Llegan en la noche la gente a golpear la puerta y dice, doctor, ya va a parir tal. Y tú saltas y realizas el parto, que le ponen tu nombre al niño. Es algo muy gratificante y comparas estos primeros años de la medicina en que tú llegas a la comunidad y tú puedes comparar esa esperanza que tenía el pueblo en que tú retornaras a cumplir con ese deber de ayudar a la gente más necesitada.
Hoy 211 años que llegaron nuestros ancestros a estas comunidades y aún vivimos aquí y nos sentimos tan orgullosos por ese color de la piel que Dios nos ha dado, la madre tierra, la naturaleza, ser Dios en vivo. Eso significa ser garífuna, ser un Dios en vivo.
Antes, nuestros antepasados hacían botes de esto, cayucos grandes para viajar de aquí hasta Trujillo, hasta La Ceiba. Esa era la vía de comunicación de nosotros para poder llegar a la ciudad. Pero siempre que se golpea uno, o se fracasa uno, o cualquier cosa que le pase a uno, tendría que ir de aquí hasta Trujillo para poder buscar medicina. Y ahora con eso aquí, puche, es un orgullo grande que tenemos nosotros.
Alguien se acordó de nosotros que nosotros existíamos en esta zona, para que hubiera un médico garífuna que nos entendiésemos mejor y para que no nos tuviéramos que morir en lo que es el trayecto de la carretera de aquí, de la zona de Illona hacia Tocoa. Dios es verdaderamente garífuna porque nos lo ha demostrado que nosotros tenemos el derecho de vivir y tener una educación y salud adecuada.
Al principio, como te dije, teníamos muchos temores porque somos jóvenes y lo primero que pensamos es de qué forma nos van a recibir en la comunidad. En estas zonas de acá hay muchos tabúes que ellos no te van a decir, no te van a soltar como para decirte, tengo tal enfermedad, por ejemplo, una enfermedad de transmisión sexual. Es difícil que un paciente te lo diga, ¿me entiendes? Por las costumbres que existen en las comunidades, los tabúes, los mitos. En cambio, con nosotros es muy diferente, porque hablamos la misma lengua. Ellos nos comprenden palabra a palabra lo que nosotros queremos saber para llegar a un diagnóstico como tal. Conocemos sus problemas sociales, personales, todas las adicciones que existen, el alcoholismo, la drogadicción, la promiscuidad. O sea que conocemos todo a fondo de las familias. ¿Entiendes? Y ellos confían en nosotros porque nosotros nos hemos ganado esa confianza a medida que ha pasado el tiempo.
Decidimos, después de graduarnos en la Escuela Latinoamericana, hacer un esfuerzo colosal y buscando recursos. Nos donaron este terreno, hicimos una champa de plástico, empezamos a buscar donaciones de medicamentos y empezamos a trabajar para demostrarle a la gente que nosotros tenemos una concepción diferente, una idea nueva de la medicina, de llegar ahí donde la gente, tocarlo. Lo que nosotros buscamos aquí en la sociedad garífuna es crear un modelo. Como nosotros, los egresados de la Escuela Latinoamericana, bajo esos principios que Fidel nos inculcó, de ser médicos de ciencia y conciencia, integrales e incondicionales, dispuestos a marchar a cualquier oscuro recóndito rincón del mundo para prestar los servicios de salud, ¿cómo podemos establecer un modelo en esta sociedad capitalista, un modelo de salud alternativo para los pobres?
La misma miseria que nosotros miramos en los países latinoamericanos, la misma exclusión de los humildes, las grandes masas desprovistas, desposeídas, cada vez más los ricos se hacen más ricos y los pobres se hacen más pobres. Las masas aumentan más, las cadenas de pobreza aumentan cada día más y más. Y creemos de que como pobres tenemos un papel.
Visibles están las huellas de la destrucción en Haití a 2 meses del terremoto. Algunas no se ven, pero quedarán para siempre. Sin embargo, una mano tendida puede aliviar el dolor, puede iluminar la noche más oscura. Una mano que se tiende puede ayudar a recomenzar.
Yo dejé el trabajo, tenía 2 trabajos, trabajaba en 2 lugares, dejé a la familia, ya la vida por allá, dejé todo y me vine siguiendo mi corazón.
Nosotros somos los que tenemos que llevar esa idea de que el médico está para la gente y vive por la gente, no importa si tiene dinero o no tiene.
No deseamos otro pago que no sea las gracias de nuestro paciente y el tener la satisfacción de que salvamos una vida, de que hubo un niño que llegó enfermo y salió bien, de que vino una madre que nosotros pudimos atenderle su parto y trajimos una nueva vida a este mundo. De hecho, yo he ayudado en 2 partos y ya hay una niña que lleva mi nombre.
Son médicos graduados en la Escuela Latinoamericana de Medicina de Cuba. Ellos la llaman por sus siglas, ELAM. Viajaron a Haití, impulsados por sus principios humanistas. Se unieron a la Brigada Médica Internacional Henry Reed para dar salud y amor al pueblo haitiano.
Porque no hay mejor idea que formar médicos. Todos los profesionales son útiles en su rama, pero un médico siempre se va a necesitar porque siempre va a haber gente enferma, siempre va a haber niños con necesidades, ancianos. Y qué más saber que cada uno de nosotros podemos contar con médicos para el mundo.
La lluvia hace más difícil la vida en Olympia Park, uno de los tantos campamentos de desplazados por el terremoto. El agua acumulada frente a la carpa, que habitualmente se usa como puesto médico, obligó a la comunidad habilitar otro espacio de consulta para las jóvenes doctoras graduadas en la ELAM.
Ellos ríen poco, pero nosotros muchas veces sentimos, cuando pasamos, ellos nos estrechan, o sea, la mano o nos demuestran una pequeña sonrisa que para nosotros es lo suficiente.
La tarea de esta doctora peruana es recorrer los campamentos junto a un epidemiólogo y a un especialista en control de vectores para evaluar la situación sanitaria.
Y más ahora con la temporada de las lluvias, las condiciones de la vivienda no son buenas, se han mojado cantidad, tampoco tienen una disposición adecuada de la basura por falta de conocimiento en la cultura sanitaria.
Ha 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 ha.